Fora TV. The world is thinking.
There really is only one conclusion that you can draw from this, and that is that the criminal justice approach to illicit drugs has failed comprehensively. But it hasn't failed for everyone. It has worked for some people. It's worked well for politicians, for criminals and terrorists. And I'd submit that not only has this failed, it's failed comprehensively, and it can't be made to work. Why not? Well, we can't keep drugs out of our prisons, and if we can't keep drugs out of our prisons, how on earth can we keep them out of King's Cross, St Kilda, Fortitude Valley or wherever? Also remember this huge price gradient that this system imposes on a kilogram of heroin. A kilogram of heroin in Bangkok will cost, wholesale will cost $1,000. By the time it gets to New York or Sydney or Amsterdam or London, it costs $300,000. There's always going to be someone who's prepared to take those sort of risks. After the fall of the Berlin Wall, we're all supposed to be more sensible about the power of market forces, and just about everyone is these days. There are a few people who aren't: the North Koreans, the Cubans, the Albanians, and supporters of the war on drugs. Another problem we have is that, unfortunately, the drug traffickers have got more resources, better resources, than the police trying to stop the drug trade. We also have to remember that alcohol prohibition in the United States from 1920 to 1933, when it was repealed, was an even more abysmal failure than what we see today. And if it couldn't work for alcohol, how's it going to work for illicit drugs? So we have to ask ourselves, what's plan B? What should we be doing instead? And I think the threshold question is that we should be regarding illicit drugs primarily as a health and social issue. And once we make that decision, we have to then raise the funding for health and social interventions to the level enjoyed by drug law enforcement. We have to shift from low-cost, high-impact interventions. We have to shift from high-cost, low-impact interventions to low-cost, high-impact interventions. I think we'll have to keep penalties for unauthorised large-scale transportation of all psychoactive drugs, be they alcohol, tobacco, prescription or currently illicit drugs. But the threshold levels and the nature extent of penalties should be proportionate to the harm that these drugs cause. We should continue to provide well-funded, research-based drug education for schools and communities, but this time with realistic expectations. I think we should be repealing criminal penalties for personal possession and consumption of drugs. We should also be moving on to regulate and tax cannabis production and sale. And some of the revenue from this should go for prevention of drug use and reducing the harms from drug use. Cannabis packaging should include warning signs about fair warning signs about the dangers of taking cannabis, and also assisting people who want to stop or cut down. Next step, we need to provide attractive, effective and evidence-based drug treatment. Choice is important. We have to meet the demand for drug treatment, and the quality of this treatment should be equivalent to the quality of other treatments we provide in the healthcare system. Treatment should be based on a solid commitment to research, which drives progress in the healthcare field. We should expand non-custodial sentencing options. Incarceration should only be used as a last resort. If all of these things that I've just said prove to be unsatisfactory, we might then consider the possibility of making available commercial retail sale of small quantities of dilute psychoactive drugs. We've been down this path before. Until 1906, edible opium was taxed and regulated and sold in Australian grocery shops, and then it was banned in 1906. Coca-Cola contained cocaine until 1903. So this is not a new policy, this would be going back to old policies. And of course we should continue to keep harm reduction as Australia's official national drug policy. This is now the global mainstream drug policy.